Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Stillbirth. Introduction. A stillbirth is when a woman loses a pregnancy after she has passed her 20th week. The baby does not survive. Stillbirths are due to natural causes. They can happen before delivery. They can also happen during delivery. In at least half of cases, it is not possible to tell why the baby died. Counseling may help you cope with your grief. Many women who have a stillbirth can go on to have healthy babies. This program helps you understand stillbirth. It talks about its causes. It also covers the treatment of stillbirth. The female reproductive system. This section talks about the female reproductive organs. These organs are in the pelvis. They are found between the bladder and the rectum. The female reproductive organs are the ovaries, the fallopian tubes, the uterus, the cervix, the vagina. The ovary releases an egg. The egg goes down the fallopian tube to the uterus. It can become fertilized along the way. If a woman gets pregnant, the fetus stays in the uterus until delivery. The uterus is able to grow a lot. The lowest part of the uterus is called the cervix. It opens into the vagina. The vagina is also called the birth canal. It opens to the outside of the body. It opens between the urinary bladder opening and the rectum. Pregnancy. During pregnancy, the baby floats in a special fluid. This is called amniotic fluid. Both the baby and amniotic fluid are in a bag called the amniotic sac. The baby gets nutrients from the placenta. It is attached to the inside of the uterus. The placenta grows with the baby during pregnancy. The mother's blood enters the placenta. It brings oxygen and nutrients to the baby's blood. The mother's blood also picks up waste from the baby's blood. The umbilical cord allows the baby's blood to travel from the baby's body to the placenta. The mother's blood does not go into the baby's body. It is kept separate. When it is almost time to deliver the baby's head drops down into the mother's pelvis. This causes the mother's belly to look slightly smaller. This is called lightening.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Stillbirth. Stillbirth is when an unborn baby dies after being in the mother's womb for at least 20 weeks. It is not a cause of death. Over 2 million stillbirths happen each year around the world. In at least half of cases, it is not possible to tell why the baby died. Most stillbirths happen before a baby is born. It can also happen while a baby is being born. Stillbirths are due to natural causes. Some women are at higher risk of having a stillbirth. For example, a woman who is over age 35 while she is pregnant has a higher risk. African American women are also at higher risk. These women are twice as likely as white women to have a stillbirth. Healthcare providers are not sure why this is. Mothers are also at higher risk for stillbirth if they are obese, are pregnant with more than one baby at a time, have diabetes or high blood pressure, smoke. Stillbirths are not as common as they used to be. Healthcare providers closely watch pregnancies that are high risk. There are also better treatments for certain health problems. Causes. Stillbirths can be caused by problems with the mother or the baby. In some cases, it can be caused by problems with the umbilical cord. Other times, it is problems with the placenta that can cause stillbirth. Some women may have long-term health problems when they are pregnant. Some examples are high blood pressure or diabetes. These problems can cause the baby to grow slowly. They can also cause problems with the placenta. These can lead to stillbirth. Stillbirth may also happen because of infections. They may affect the mother or baby. They may also affect the placenta. Some of these infections do not cause symptoms. If they are not treated, they can cause stillbirth. Babies that are growing too slowly in the womb have a higher risk of stillbirth. Almost half of stillborn babies grow too slowly. Some stillborn babies have birth defects. Birth defects are abnormal changes that a baby has at birth. They can be caused by changes in the baby's genes. They can also be caused by other factors, such as if the mother smokes or drinks while pregnant. The umbilical cord may get a knot in it, or it may not be placed the correct way inside of the placenta. These problems prevent the baby from getting oxygen. The unborn baby dies if it cannot get enough oxygen. Problems with the placenta can also cause an unborn baby to die. The most common problem happens when the placenta pulls away from the uterus. This is called placental abruption. It can cause a lot of bleeding. This can be life-threatening to the mother and baby. There are also other possible causes of stillbirth, but these are less common. They may include lack of oxygen during birth, Rh disease, trauma such as car accidents. Symptoms. Some women may not have any symptoms of a stillbirth. In some cases, the symptoms may not be easily noticed. Often, healthcare providers tell pregnant women to do a kick count. This starts around 28 weeks into the pregnancy. It is done every day. A kick count is exactly what the name says. It is counting how many movements an unborn baby makes. There are many ways you can do this. Usually, a kick count is done by seeing how long it takes the baby to make 10 movements. The baby should make 10 movements in about 2 hours. It may take less time than this. It may even take as little as 15 minutes. Always do a kick count at about the same time each day. Choose a time when your baby is most active. If you notice any changes in how much your baby moves, call your healthcare provider right away. He or she may want to do some tests to make sure the baby is healthy. Call your healthcare provider right away if you have vaginal bleeding. Also, call if you have sharp pain in the abdomen. These may be signs of a serious problem. If you have any other symptoms or changes that worry you, call your healthcare provider. It is better to be safe and make sure nothing is wrong. Diagnosis. If you notice any changes in how much your baby moves, your healthcare provider may do some tests. These tests can show if the baby is still healthy or if there is a problem. An ultrasound is often done. This test uses sound waves to make a picture of the baby in the womb. It can show if there are certain problems with the baby. It may also be able to show if there are problems with the placenta or umbilical cord. A CTG is also used. CTG stands for cardiotocograph. It measures the unborn baby's heartbeat and records it on a paper. The monitor is placed on top of your belly and is held in place with a belt. A CTG can tell if the baby's heart has stopped beating. If it has stopped, the baby has died. The baby will be stillborn. Treatment. Your healthcare provider will explain the options you have for giving birth to the baby. Sometimes the baby must be delivered right away. This is often done for health reasons. Many times a couple can decide when they want to have the baby. You can wait until labor starts on its own. This can take up to 2 weeks after the baby dies. If labor does not start on its own after 2 weeks, you will need to be induced. This means that you will be given medicine to start labor. Many couples choose to induce labor after they learn the baby has died. Often the baby can be born vaginally, but if problems develop, the baby may need to be born surgically. This surgery is called a cesarean section. It is also called a C-section. You can also decide before giving birth if you want special arrangements. You may decide to give birth in a room away from other women that are having babies. You should also think about if you want to see your baby or give your baby a name. Some couples have pictures taken. Counseling may help you cope with your grief. You may get counseling on your own or with your partner. You may also join support groups where you can talk with other parents who are going through the same thing. If you decide to try to have another baby, talk to your healthcare provider. He or she can help you lower your risk for another stillbirth. Many women who have a stillbirth go on to have healthy babies. It can also help to try to find out what caused the stillbirth. Tests can be done to try to find a cause. It may help you cope with your loss. It can also help you know how to lower your risk if you decide to have a baby in the future. The placenta and umbilical cord can be looked at and tested after birth. Often, an autopsy is done on the baby. Blood tests can also be done to look for gene changes that could have caused the death.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A stillbirth is when a woman loses a pregnancy after she has passed her 20th week. The baby does not survive. Stillbirths are due to natural causes. They can happen before delivery. They can also happen during delivery. Stillbirths can be caused by problems with the mother or the baby. In some cases, it can be caused by problems with the umbilical cord. Other times, it is problems with the placenta that can cause stillbirth. In at least half of cases, it is not possible to tell why the baby died. Some women are at higher risk of having a stillbirth. Mothers are also at higher risk for stillbirth if they are African American, are obese, are over age 35, are pregnant with more than one baby at a time, have diabetes or high blood pressure, smoke. Counseling may help you cope with your grief. Many women who have a stillbirth can go on to have healthy babies.
Thank you for using Explain.